review. And what we were trying to do was find out, really, we had a hypothesis that there was a gap between what people with epilepsy and their caregivers are experiencing in conversations or lack of conversations about the risk of SUDEP, sudden death and epilepsy, and what's actually happening in the consultation process. And rather than conduct primary research, we were aware that there had been quite a lot of research already existing. So we did a systematic literature review. We looked at studies just over a 10-year period, so from the beginning of January in 2013 through to early April 2023, using PubMed, and we were using search terms associated with SUDEP counselling, education, caregiver, clinician, and of 172 studies, we identified 60 that focused on SUDEP conversations. So just to be clear, this is about the conversation about SUDEP risk. It's not about the incidence of SUDEP per se. Well, I think there are sort of four main things that came out of it. The first thing is that the review told us that the majority of people with epilepsy and their caregivers want to be told about the risk. They feel that they have the right to know about the risk of SUDEP. The second thing that came through was that they felt that if they were told about the risk, it would give them the opportunity to take risk mitigation measures. Now, we know with SUDEP can't always be avoided, but people at least wanted to be given the chance to think about potential mitigation strategies to reduce their likelihood of having a seizure if there are known triggers, for example. We also found that bereaved caregivers who hadn't been told about the risk of SUDEP felt an advanced degree of trauma and shock. I mean, if you lose someone in your family to SUDEP, that is a terrible trauma in your life. But imagine if you didn't even know it was a possible risk, the trauma is exacerbated even more, and that's what we were told. And they also reported a feeling of regret and guilt about not having had the chance to try risk mitigation for their family member, because they felt that if they'd had the information, they could have tried to do something. So of course that makes the trauma and the bereavement even worse. And the other thing that came through from the research is that the provision of SUDEP information has no or very low adverse effects on overall health of the person receiving the information, and at the same time could increase the likelihood that they could improve their seizure control. Most agree that counselling is important when it comes to SUDEP, but fewer than 12% were talking about the risk of SUDEP more than 90% of the time. So the question is, why are physicians reluctant to have these conversations? And there are a number of reasons that are given, to do with lack of time, to do with the perceived emotional reaction of the patient or the caregiver, anxiety about the impact of quality of life of taking someone away with this new risk that they didn't know about. Sometimes there's a belief that prevention won't work. Sometimes there's an assessment that the patient is at low risk of SUDEP. So all of these things are influencing the physician's decision. And the hypothesis that I have is that there may well be some subconscious barriers to having what is essentially a very difficult conversation as well.